Blood coagulation, the process by which soluble fibrinogen converts into insoluble fibrin or fibrin, is called blood coagulation. Fibrinogen is a protein produced by the liver and is soluble in plasma. Only plasma can coagulate and does not need any red blood cells. In vessels lining, healthy endothelial cells produce various compounds like nitric oxide, prostacyclin, which is a special type of prostaglandin, and ADP dephosphatase. These are antiplatelets aggregation agents and do not allow platelets to stick to the vessels. Platelets has to be activated to stick to the endothelial cells. Remember, ADP favors the stickiness of the platelets and ADP dephosphatase stops them to stick to the endothelial cells. Platelets don't have nucleus. Their size is 2 to 3 microns while RBC size is 7 to 8 microns. Platelets' total lifespan is 8 to 10 days. Healthy endothelial cells also produce heparan sulfate, which provides a platform for antithrombin 3, a protein which is produced by the liver. Antithrombin 3 stick to heparan sulfate and cut down the thrombin molecule activated factor 9 and 10. Healthy endothelial cells do also produce thrombomodulin to modulate thrombin molecule. The molecule will activate protein C, which will digest activated factor 5A and 8A. Tissue plasminogen activator is also produced by the healthy endothelial cells, which converts plasminogen into plasmin, and plasmin will degrade the fibrin fibers. The first response to the injury is the vessel goes into vasoconstriction, and from nerve endings, neurogenic reflex vasoconstriction happens. Smooth muscles undergo myogenic constriction. Endothelial cells produce endothelin to act on the smooth muscles and contract them. Injured endothelial cells produce vasoconstrictor. They also produce a von Willebrand factor, which is very sticky and unite with the underlying collagen. And now they will start engaging platelets from the other side. The receptors on the surface of platelets for von Willebrand molecules are called GP1B, glycoprotein 1B. The process of platelets adherence on the von Willebrand factor is called platelets adhene. After platelets adhene, phospholipase enzyme is activated in the platelets, which breaks down the phospholipids in the platelets into arachidonic acid. Some of this arachidonic acid will break down the thromboxane A2 with the help of an enzyme called cyclooxygenase. Thromboxane A2 has two functions: vasoconstriction and platelets aggregation. Just a reminder, prostacyclin is a vasodilator and thromboxane 2 is a vasoconstrictor. Aspirin inhibits cyclooxygenase, thus stopping arachidonic acid conversion in thromboxane A2 and discouraging platelets aggregation and vasoconstriction. As soon as platelets bind to the von Willebrand factor, they release some alpha and delta granules. In delta granules, there are three very important substances: SAC, serotonin, ADP, and calcium. Serotonin is a vasoconstrictor. ADP turns the platelets in active form for platelets aggregation. Drug ticlopidine stops ADP so platelets don't stick. Calcium pin the coagulation factor into the phospholipid's floor. Glutamic acid is found in coagulation factors, and one point of glutamic acid is carboxylated, called gamma carboxylation, means their carboxyl COO points are negatively charged. Calcium come and bind with two adjacent coagulation factors carboxyls or COO points which were negatively charged, and now coagulation factor 9 and activating coagulation factor 10. Vitamin K dependent enzymes make glutamic acid carboxylated. Alpha granules in the platelets release alpha factors. They are coagulation factors, fibrinogen, platelet-derived coagulation factors. Remember, the first layer of platelets to bind with the von Willebrand factor was platelet adhesion, and all the next layers of platelets will be called platelets aggregation, and they will make primary platelet plug. It is also called primary hemostatic plug. On this plug, fibrin comes and binds, and now it is called secondary hemostatic plug. It is very tight. Intrinsic coagulation factor. Within the blood, coagulation factor 12 is present, which when touches some non-endothelial cells make the blood coagulate. To fail the intrinsic pathway, scientists added citrate, which is negatively charged. They bind with calcium, which is positively charged, and help the coagulation and thus reduce the intrinsic coagulation factor. But if any tissue blood is added, the coagulation will occur again. Now it's called extrinsic pathway with an E. Thromboplastin is the tissue factor, just some lipids plus lipoproteins. It can activate coagulation factor 7. From liver, coagulation factor 12 will come and with the platelets convert into activation of From liver, coagulation factor 12 will come and convert it in active coagulation factor 12. Active factor 12 will activate factor 11. Activated factor 11 will activate factor 9. In the presence of phospholipids, which was the floor provided by the platelets, calcium and factor 8 can activate factor 10. Activated factor 10 will convert prothrombin into thrombin. Thrombin will convert fibrinogen into fibrin monomers. Thrombin also produces thrombin stabilizing factor or factor 13, which join fibrin monomers strands together. In the meantime, tissue factor will convert factor 7 into its active form, which can either activate factor 9 or activate factor 10. Now it's called secondary platelet plug. The secondary plug, if present in normal circulation, is called thrombus, and if outside the cardiovascular system, called clot. Embolus is a part of secondary platelet plug, goes into the circulation and may damage the tissue. When the secondary plug or thrombus is so big that it's blocking the whole vessel, endothelial cells grow from the both sides and go inside the platelets and dissolve them and make a canal from where the blood can flow. Then the canal will start getting bigger and at last